Let's stay with the theme of the big story we're covering for you today. Concerns, of course, being raised about the spike of suspected food poisoning incidents in the country. Scores of children in particular have been affected in the past couple of weeks. It's not yet clear whether there's any deliberate or criminal intent in any of these cases. However, as you can imagine, the incidents have brought into sharp focus food hygiene and safety priorities to ensure everyone's well-being. Let's get a better understanding of how we're responding to this. Bring in now the Health Minister, Dr. Aaron Motsoaledi, who joins us via our video link this morning. Minister, thank you so much for making time in your busy schedule. Really do appreciate it here on the SABC News channel. There is a statement being attributed to the department dated this Monday saying that Nat Joints is actually treating these food case incidents as a national security threat. Are you able to break down for us what that actually means?
Well, good morning, Ayanda, and good morning to the listeners and viewers. Well, they regard it as a security threat because if you find so many incidences where people get sick and even others die, and yet we do not have any answer of exactly what is causing it, what is going on, it becomes a security threat. And that's why they ordered that the Department of Health must coordinate all the structures that were investigating this, because there were quite a number of structures, at least 5 government entities, which have already been on the job investigating, but they were doing so separately and independently. And they said we must coordinate them. And we're able to do so. So we call it a security threat until such time that we are able to make head or tail of actually what is going on. Because as we have already said, it's not in one area. Yes, we had a tragedy in Naledi, but we are talking of Mpumalanga, Limpopo, etc., etc. And there are people who believe it might be having to do with the school feeding program of the food that is given to kids at schools. Up to so far, we do not think so, because we believe these kids are buying the food outside the school premises. And that's why we need to work around the clock to find out exactly what is that which we are dealing with, which is so generalized.
You were still trying to unpack for us just what this approach by Nat Joints actually means, practically speaking, insofar as approaching this as a national security, I beg your pardon, national threat is, I think, the term I'm looking for. Practically speaking, what does that coordination entail? I'm trying to pinpoint what people can be seeing on the ground, especially in a context where people feel like this is spiraling out of control.
Well, I'm sure you are aware that action has already been seen, especially in what the coordination entailed was that as Minister of Health, I need to call all the structures that were already on the ground. For instance, number one, immediately after these incidents, a team of detectives was sent to Naledi in Soweto to find out what happened. And they've been there ever since, and they are still there. But the environmental section, environmental chief directorate at the National Department of Health has also been there, as is the environmental section of the city of Johannesburg. They've been there. Agriculture has been on the ground trying to sniff around what could be happening, because this is to do with foodstuffs, which they are the ones who produce. But the National Consumer Council or National Consumer Commission, which is responsible for security of goods that are sold to consumers, have also been there. As I said, the problem is that they were all going independently, each one applying the part of the law which is relevant to their mandate. Now, we called them together on Tuesday last week, not this week. Tuesday last week, we called all those structures together, and I took the liberty of inviting the National Institute of Communicable Diseases, NICD, thinking and considering the fact that we once went through an outbreak like this, where food stuffs which were found in Poloni were contaminated, and doctors diagnosed Listeria monocytogenes. Laboratories confirmed it, but the question is, where is the source? How did it come into the food and become so widespread? We didn't have answers at that time, but the NICT was able to search the length and breadth of the country, and found that whereas most of the people who were dying were in Gauteng province in large numbers, but the source was actually in Limpopo. So showing that these things can be extremely complex. They need scientists, they need people who understand the issues. So we invited NICD, they came in. And then we agreed to put up a team of at least 80 environmental care practitioners, which we used to call health inspectors, which must be joined by the same team from agriculture, the detectives, City of Johannesburg and National Consumer Commission. And they all went to Naledi. And the NICD actually trained them on what to do, what to look for, because in that meeting, as we were sitting and analyzing, we concluded that we are dealing with a chemical agent here. I'm saying so because this type of processes can be caused by a biological agent or a chemical agent or a physical agent. I know that wildly, this is called food poisoning by all and sundry. But in medical terms, when we say food poisoning in medical terms, we actually mean food contamination. We mean food got spoiled somewhere, was not kept maybe in a fridge. It got spoiled and contaminated by bacteria, which then when ingested will cause diarrhea, vomiting, and many other symptoms. That is caused food poisoning, meaning it's caused by a biological agent. But from the description of the signs and symptoms and what we're hearing from the teams on the ground, we concluded that this is definitely not a biological agent. It is a chemical agent, but we need to look for it. We need to know what it is and be able to link it directly to what has happened.
And this is in particular to the case related to those who've died in Naledi, is that right?
Well, it is to the whole country, but because there's been a concentration and death in Naledi, we thought it will give us a clue of what's going on. That's why we sent the team specifically to Naledi. But the rest of the country, we are trying to get files from hospitals to find out exactly what doctors are finding. But we use Naledi as a case study of what's happening so that we have an understanding much quicker.
Sure. I appreciate the distinction between food poisoning and contamination. I think it's an important one to make. What the trend has also done, of course, Minister, as I'm sure you've watched the public discourse go into overdrive, is bringing to sharp focus once again questions around how we manage the running of spaza shops in the country. Even, I'm sure, in your previous stint as Health Minister, this is a conversation at some stage that must have come up. I get the impression, though, that we haven't really made any headway in getting to the bottom of how you do manage such a massive, unregulated ecosystem that is so important to communities, but that has been left untouched, for lack of a better term, for so long.
Indeed, Ayanda, but it was not left untouched. It was not as a Minister of Health that actually I did something about this. It was as a Minister of Home Affairs, because generally in the country, anything wrong that is done, presumably by a person from another country, people believe is Home Affairs. Traditional leaders and municipalities did complain about this sometimes back. So last year, in February 2023, when the president went to open the House of Traditional Leaders, because many traditional leaders have been there and they've lodged the complaint with me as a Minister of Home Affairs, I got them together, invited Minister of Culture, invited Minister of Small Business, invited Salga. We met in Cape Town to look into this issue. We found that there are a lot of gaps about mandates, who does what and all that. Then we said it needs a whole 2 days. In October that same year, we had a whole 2 days in Beachwood, in Boksburg, where we sat with all the 7 houses of traditional leaders, 7 because Gauteng and Western Cape don't have the house, where we had 36 district municipalities out of 52, where we had 6 metros out of 8, and we invited the Department of Culture again, small business, trade industry and competition, housing. We sat there for the whole 2 days. When we finished Ayanda, we developed a resolution. One of them was that it looks like we are dealing with a weakness of bylaws here all over the country. And because municipalities have different bylaws, we said then the Minister of Culture must develop a series of bylaws which will be applied by all municipalities, because the beginning of the solution of this problem, as you said, is to make sure that spaza shops are regulated, whether they are owned by a foreign national or a South African or whoever. They ought to be regulated, they need to be registered. So the Minister of Culture then started the work, and then a series of a draft document was given to us. In Home Affairs, we even workshopped it and to compare it with the immigration laws, whether they are not clashing anywhere. And then we then understood that the Minister of Culture sent it to all stakeholders to give their input, including SALCA and municipalities. Yeah. Unfortunately, while the process was going on, we had elections, and I think they disturbed everything because we had elections whereby they were supposed to take the inputs, including from us in Home Affairs and all the other structures, and then look at them, incorporate them, and gazette them, and start this work. So that work is still outstanding. It needs to be done. And after this investigation, we are going to insist that work of regulating spaza shops is very important.
Right.
My own team here, the Directorate and Environment, they said they've been all around Gauteng inspecting some of these spaza shops about health regulations. And I said, but what will be the implication if whoever whose spaza shop you went to check regulations is actually an illegal establishment? Sure. Are we not legalizing it by trying to put health regulations? If they comply with health regulations, does it mean then that it's a legitimate business?
It's a fair question to ask and an important one, Minister. Hopefully we'll see through that work, especially as we've seen because of what is at stake. That's the time we have, unfortunately, this Monday morning. Thank you very much indeed for engaging with us as always. Health Minister there, Dr. Aaron Motsoaledi, speaking to us about how government is responding to what seems to be an uptick in suspected food poisoning cases or suspected contamination cases. I'm told it's Friday morning. What did I just say? Anyway, Minister, nonetheless, thanks very much indeed.